Hi, my name is Dr. Rick Braver, sports podiatrist. I'd like to discuss the difference between shin splints, stress fractures, and exertional compartment syndrome. Shin splints basically are when there's a pulling sensation along the shin by the covering of the bone called the periosteum downwards. And this happens most frequently when the runner has a foot that excessively pronates or collapses down and also excessively toes out. So how do we stop this problem? Basically, you have the person run with the foot a bit straighter in, 15-degree angulation out is okay. But also you need to put something under the arches, whether it's a pad, an over-the-counter insert, taping, or what we use a lot of is orthotics. And our orthotic is a bit different than others in that it has a full-length extension, a runner's wedge on it. And I've taken the orthotic apart so you can see that there's an actual rubber wedge with a high point under the big toe joint, and it tapers down so by the time you push off of the toes, it doesn't inhibit flexibility. Plus, we need to provide some type of shock absorption so it's flexible so when you step down it rebounds back up. So in a nutshell, that's about shin splints. It could materialize and get worse and worse, and so we have to make sure that we take care of it in time. If not, it may end up being becoming a stress fracture. When we do see a stress fracture, unfortunately, we have to rest the runner or the athlete. Sometimes we provide a compressive brace for it, which is, this one's elastic. Some have straps on it, which make it much tighter. So it mechanically holds the muscle to the leg bone, which does help. Unfortunately, it can take up to 6 weeks for a stress fracture to heal. The third thing I want to talk about is exertional compartment syndrome. Here, there are muscle compartments, 4 major compartments in the leg, and in this, there's too much buildup of fluids and blood flow in a certain compartment, which is bound by something called the fascia. That's a covering, almost like a saran wrap, a very thick saran wrap. And when we run, the muscles engorge with blood. As we keep running for months and months, or if we're a dancer and we get very good muscle development, those muscles become very taut and very enlarged. And so when they engorge a little blood, they push on the components in that compartment, causing possible nerve injury and significant pain. So in these particular cases, we have to do a test in them. We actually stick something almost like a tire pressure gauge in here in the leg muscle. It's a very thin needle. Inject maybe 2 drops of water, and the gauge actually measures the pressure within that muscle in that compartment. And if it's very elevated, then we need to actually release the compartment. And that's treated more surgically, but it works extremely well. But we know what we're getting into ahead of time because in my office we do the diagnostic testing, and once we release the fascia compartment, 3 weeks later the patient's back running and they do pretty well. If there's any questions that you may have regarding shin pain, stress fractures, exertional compartment syndrome, please feel free to give me a call.